UCOPE project staff Mariah Wright and Danielle Good are two incredible Umatilla County and community outreach prevention engagement team members. UCOPE uses a collaborative leadership approach to develop a coordinated rural bundle of services for people who use drugs. Mariah, Danielle, and others on the team strive to support the whole health and well-being of people who use drugs across the recovery continuum through increased access to preventative and collaborative care, testing and treatment for hepatitis C and HIV, overdose prevention services, immunization, and cross-service sector collaboration, and increase availability of provider and community education about substance use and substance use disorder. Welcome, UCOPE.
Hi, everyone. I'm Danielle. I'm a senior research associate with Comagine Health, and I'm here today with Mariah and Michael to talk about UCOPE. UCOPE is Umatilla Community Outreach Prevention and Education. And I'm going to provide a little bit of information about the project, and then we're going to hear from Mariah and Michael later on about all the cool work that they're doing in Umatilla. So the agenda for this is just to give a project overview, give you a quick introduction to UCOPE. I'll talk a little bit about some of the data collection that we do on the project, partly just to emphasize the way that that then informs the work that's happening in the community. So I'll share some very brief data collection insights, and then we'll talk a lot about the work that's being done. And that includes outreach and events, and then also mobile services. All right, so this is a CDC funded project, and we have core project team members, which includes the folks at COPES, who are our local partners who do all the implementation. At Comagine, we facilitate, we have core team meetings, and then we also have a bigger group of key partners in the community. We facilitate meetings with them as well. So we have biweekly core team meetings, and then we have quarterly key partner meetings. We also help provide support on data collection and evaluation for the project. And then, of course, OHA also provides support for us. So this project is actually in year five. It started in 2021, which is amazing. We've been working on this for a while. And our project mission is to develop a team of local partners, including people who use drugs, to coordinate and implement harm reduction informed interventions to improve healthcare access and outcomes for people who use drugs in Umatilla County. And we do that through increasing access to high coverage syringe service programs, increasing linkage to substance use disorder treatment services, including medications for opioid use disorder, increased Hep C, HIV, and Hep B testing amongst people who inject drugs and use drugs, increased linkage to treatment for infectious complications of drug use, increasing the receipt of hepatitis A and B vaccines amongst people who use drugs. And this project kind of sits in a little ecosystem of projects in Umatilla that are also peer-led. So I just wanted to shout out some of the other work that's happening and how it overlaps with UCOPE. So we convene community partners, including that big group of key partners. In year one, we did a rapid assessment to sort of evaluate what was happening in Umatilla County and the needs that we saw in the community. And that involved interviewing key partners and interviewing people who use drugs and then looking at surveillance data. And then we have been developing and implementing a service delivery model, and that includes support for one of the parts of this project that was a new funded service element, which is the mobile trailer. And that includes the actual trailer was part of this project, and then also staffing for mobile services. Of course, we work with PATHS, the peer assisted telemedicine for health and substance users, via offering that through the mobile service trailer and also in other settings. Prime Plus peers and peers in general are a huge part of the way that we have been staffing the mobile services and also how we get implementation updates on this project. And so that also means that we work with the peer drop-in centers that COPES runs, which are amazing. And also Nurture Oregon is like one of the other peer-led programs in the county. So that bigger group of partners that we collaborate with includes a ton of folks in the community, and we meet with them and also share resources back to them regularly. So here's some of the folks who have been involved in the bigger group, and have participated in our needs assessment, participated in data collection, and come to our quarterly meetings. So those folks did interviews in year one, and then also participated in interviews in year four to update the needs assessment. They, of course, help build connections with organizations across the county. Those folks provide feedback on project documents and processes and also distribute project documents. So when we have resources to share. And in our meetings, we do a lot of providing updates from organizations, areas of connection, areas where support is needed. And just it's a really good local working group. This last meeting, I think we had 25 folks on the call. We get a lot of folks coming out to participate in the key partner meetings, which is great. And then they champion that work in their organizations and through their networks. Okay. For data collection, I just want to give a couple of insights into the data collection that we do. As I mentioned, we do data collection to inform project work. So I'll shout out our annual client survey. This will be the third year that we are fielding this survey. And it's a really simple survey, and I think it's really informative as well. So we ask people, clients, what services they've needed in the last 12 months, what services they've accessed, the reasons that they did not get the services that they needed, and then open-ended questions about what do they want to see, what do they need more of in the community. And so it's open right now. It is tied to Community Appreciation Dinner, and also then kind of runs through this season of being reflective and thinking about what you are receiving from the community and what you'd like to get from the community. And so this is from last year's results because we're still fielding the survey now, but I did want to call out a couple of things here at the top. So the thing that we heard the most about what people did not, why they did not get the services they needed was that they were not sure where to go to get the services that they needed. And then some things that we think of as like classic barriers, especially for rural communities. So not having transportation and then not being able to get an appointment or that there was a long wait list. And then another little round of data collection that we did is doing an update on key partner interviews. So that was talking to participants from healthcare, public health, community corrections, treatment, recovery, housing, and harm reduction. And so we treated those folks as subject matter experts and asked them about service changes in Umatilla County over the project window. So since 2021, when we started this project. We asked about collaboration, which is a key goal of this project. And we asked about what people were interested in seeing from the mobile services, which is like a regular check-in that we do to see what the community would like to get from the mobile services. So I'll just share really quickly that there were a lot of wins in Umatilla since 2021, more peer services, increased access to medication for opioid use disorder, more mobile services in the community, naloxone availability, youth-focused efforts, and just improved community awareness. So these were all things that key partners pointed out. And they talked about what was helping with collaboration in the community between organizations and what was increasing collaboration. And one thing that they really highlighted was shared outreach events and personal relationships are a big part of how organizations collaborate in Umatilla. And that community education, prevention, and stigma reduction efforts have helped with visible unity across agencies working together in Umatilla. And they shared the goal that they wanted to break down silos and maintain relationships even between outreach events. And that is to reinforce a cohesive community-wide approach. Okay, so thinking about these two pieces of data, one, which is that folks in the community identified that they're not always totally certain where to go to get the services that they need, and they have a lot of transportation barriers to getting there. And thinking about collaboration wins, the collaboration has been really impacted by events and outreach. And this goal of maintaining some of that momentum that happens during events and outreach throughout the year in between big events, I wanted to highlight some of the project work that's being done. So first of all, Mariah, do you want to introduce yourself and your role?
Yeah, I'm Mariah Wright. I am the peer program manager here at COPES.
All right. And we're going to do this sort of question and answer. So Mariah does, like I said, all the implementation work that happens in the community for UCOPE. And so the first thing that I wanted to ask you is why outreach is so important in Umatilla.
Um, so I would say that, so there's two different types of outreach, right? So we do one outreach, which is like going out into the camps. And so I feel that that type of outreach is super important because there's a lot of unserved population that does not come in for services, in the community and stuff like that. Like it's the stigma, or the fear of being judged or, past the way they've been treated in the past, things like that. And so we bring a lot of our services to them. And then there's also our outreach that we do at events, which is also super important because that's where we provide like a lot of our education and our prevention work in the community to help break down those barriers of stigma.
Amazing. And will you tell us a little bit about unity within the community? I featured some of the previous unity within the community visuals here.
Yes, so unity within the community is pretty much it's a coalition of all the local organizations. And so the main thing that we do is we come together each year and we plan like 4 events throughout the whole year that we are able to put on together. But the whole focus is for us to band together to help, like it was saying in that thing, break down those silos and things like that in between other community partners because we're all trying to serve the same population who all have different needs that need to be met. And there's some resources that we don't have that other agencies have. And so being able to have that connection and that warm handoff of already knowing and working with them through unity within the community has been super beneficial for not only us, but also our clients' recovery in their program. So I would say that, yeah, unity within the community, it's been pretty impactful.
Do you know off the top of your head how many agencies are in unity within the community?
I last I knew, I want to say there's 32,
Wow, yeah,
which
that's
is
amazing.
within Umatilla County. So
That's remarkable. Okay, and then will you tell me about some of the events from this past year that you're really proud of?
yes. So one event that we do each year, which I think is really impactful, is the Break the Stigma, which is a unity within the community event. It's actually probably our biggest event. That's where a lot of like our like what you see on here, the pictures, that's our commitment boards. And so that event is super impactful because it's based around the the individuals like them. It's client-centered event, right? And so it's a lot of like resources, prevention talk. I know one year we based it around youth, and so we actually had youth speakers who shared their story of their own recovery and things like that, which was super like impactful for a rural community to hear like the story of a youth and how it's touching them and what's, like it was just so Break the Stigma has been like probably one of the biggest events that we have in the community. And I know it's one that a lot of people always talk about. And then Roundup is probably our other big event that we do. We go down and we park the trailer down at City Hall and we do hot dogs and we kind of hang out. This year we played a lot of cornhole with our clients and we had free haircuts there. We had the mobile trailer there. We collaborated with UCO Health to provide vaccines. And so it's also nice because during Roundup, a lot of like our clients get pushed out of town. And so now that they know that they have a safe place that they can go hang out and feel welcomed and accepted, a lot of them actually stay in town more just to be there. And then I think the last one I just want to touch on is the dinner. You touched on it earlier, but this one's really big. We just had it actually. And again, it's where we do our survey, but it's also an opportunity for us to share that connection with community partners. Like everybody, the whole community is invited. So it's a great opportunity for everybody to come together and maybe get a chance to sit down and eat with that individual that you might have like was too quick to judge on the side of the street. You know what I mean? And you get to hear their story and things like that. And so, yeah, and just that human connection and not being alone during the holidays.
That's all so big. I think those are all such important things. Okay, and then we also really wanted to highlight the mobile services. And so, Michael, do you want to introduce yourself and your role?
I'm Michael Payne, UCOPE Program Manager.
Cool. And I was going to ask similar questions, but first I wanted to hear about the mobile services. For folks who have never been on the trailer, just tell us about the mobile services, what the space is like, what it's capable of.
The mobile trailer goes out and meets clients where they're at, whether it's going down to the camps. We got the back set up for like wound care or doing blood draws or any of the testing needed. The middle of the trailer kind of set up for that casual care services, where we got brochures and community partner business cards, so that way we can link the services as needed. I can also do a level of care assessment to start their recovery journey out right there, so they're not having to go in somewhere.
Very cool. And it's a 20-foot trailer? How big is it?
It is very big,
Yeah.
definitely monstrous and heavy. So
Okay, so you are getting started as the peer lead for the mobile services. I'm wondering if you can tell us a little bit about your vision for mobile services. I put in this next year, but what's your vision for what the services can offer?
So I know that before it was ran as like a doctor or a nurse-led program. This year we're doing started a peer-led, and so the collaboration with a nurse coming in and doing it. So just meeting them where they're at and gaining that rapport with them, so that way they're comfortable enough to get the testing or get treatment for the different things. Also want to do some get out in the camps during the winter time. It's really hard for them to get out and go. They get frostbite and go get that taken care of. So hopefully we've got a nurse that they just hired, and we're going to get out there, hopefully do some wound care and just make sure that the clients are taken care of. During summers, I know that there is a shower on there. So if I can find the right location, be able to offer mobile showers as well would be a nice vision.
Is there any particular service or thing that you're really excited about offering on the trailer?
I mean, just meeting them where they're at and gaining that rapport with them, and then just watching people grow. The collaboration between community partners. As I said, Mariah said, UCO Health has done vaccines from out of the trailer. Going to talk to wound care clinics. I'm just building the partnerships with new organizations, because just finding out what other people are offering in the community, being there and just trying to get a better understanding of where we can use the trailer for the best support for the clients.
Very cool. And on our last key partner meeting, there was a lot of interest. So that was exciting. Michael was able to join and share contact information. And then we got our contact information out to all the partners to just make sure that people know that the trailer is available and that you guys are ready to work with other organizations, which I thought was a really nice aspect of that meeting. Is there anything else that you guys want to plug before I close out?
All right. It has been nice having a lot of reach out from the different community partners, just seeing what we're able to offer, and then talking about collaboration in the future. I know that I've been working with the UCO Health at going down and doing our HCV testing, where they're already doing testing and offering gift cards out there. They're just not doing that particular one. So they didn't invite many community partners, but they turn in, since we are offering a different test and being able to link clients there. They're going to allow us to come down. So,
Very cool. Very cool. Lots happening. So that's very exciting. Okay, and a couple of times I've referenced resources that we've put together on this project. I just want to shout out one that I think is useful to folks who join this meeting, which is that we developed, based on feedback from people who use drugs, a safe provider checklist it's really for any space, but we sort of geared it towards medical settings for providers who are interested in making sure that they are providing a welcoming space, a non-stigmatizing space. We created this sort of document that you can reference for ways to make sure that your space is welcoming to everyone, but especially geared towards people who use drugs. So you can go to our link tree, which is right here, or go to our QR code, and that document is available for anyone who thinks that they would find it useful or that they want to distribute. And if you have any questions, feel free to reach out to us. If you want mobile services to come out and you're in Eastern Oregon, reach out to Michael. And that's it. Thank you.
thank you.